everybody. Hope you're having a good day. Hey, I think today we are going to do some hair. We're going to try out this new winged liner. And in honor of Halloween or October, I may even do a little pumpkin design. I like to kind of do some Halloween looks, so I'll do those videos starting with today. I also want to talk about hypothyroidism or thyroid conditions. And we're going to do a little bit of a deep dive today on that. So we're going to talk about that as well. So as you can see, I'm just using my little flat iron, and I'm using my, I just like to bend and pull that through. Did a little bend and then pull straight. Bend and pull straight. So, first of all, a lot of what I see in my practice are women with hormone conditions, and one of the big ones are thyroid conditions. And when I worked at a general endocrinology practice, which I did, I saw how the endocrinologists and the physician's assistants treated the patients. And patients usually got, they waited in the room for about 20 minutes, and then the practitioner was in there for about 5 minutes tops. And then nothing really was explained in detail because it can get pretty confusing, and there's a lot of questions. And that's why the endocrinologist I worked with said, you can't spend an hour in the room with a patient, you're taking too long. And that's when I was like, I don't think this is for me. I'm going to have to open up my own office, because the patient needs to be part of the team and they need to understand what's going on. And endocrine conditions take a lot of explaining, and there's a lot of questions that go on with that. And you can miss a lot of things if you don't talk to the patient long enough. So we're going to do a deep dive today about thyroid conditions. Okay, let's see. Did I put enough bend in here? Let's do a little bit more. Okay, so many women, when they come in, if they complain, like, I'm really tired, my skin is so dry, my hair is starting to fall out, my eyes are puffy, my digestion has changed, my lower legs are getting puffy, I'm retaining fluid. You know, I always want to rule out other conditions, such as menopause, perimenopause, what they're eating in their diet, and then, of course, do a general physical, get some general blood work before I just jump to thyroid. But, you know, there's some basic lab tests you can ask your doctor for if you've been doing some reading and you think it's thyroid disease. But let me back up a second, and we're going to start from the beginning. Oh, I have to move my light a little bit. Let me see if that's going to ruin things. Is that going to ruin things? I might have to move the light for a second. Oh, I think that just kind of stays the same. I don't think that changes anything. Okay, so starting from the beginning, talking about thyroid. So, as I said, thyroid condition. So the one I see the most of is hypothyroidism, which means low thyroid activity. Hyperthyroidism is overactive thyroid. So you're putting out too much thyroid. I mostly see low thyroid. And so we call that hypothyroidism. So that is a disorder that usually we see first as primary care doctors. If it's getting a little too complicated, like nodules are involved, or we assume most of the thyroid is destroyed, we'll usually refer to endocrinology. But if it goes untreated, this can contribute to problems such as high blood pressure, high cholesterol, problems getting pregnant, brain fog, just not being able to think clearly. And then, of course, having low thyroid in a baby or a child needs to be addressed immediately, because that can lead to mental dysfunction, problems learning, and low IQ. So very important. It also can lead to central nervous system dysfunction, neuromuscular dysfunction. We do a test on the tibia of the lower leg, and if there's flexion, or it almost looks like the foot is flipping, that is a sign of a thyroid condition. So the prevalence does increase with age. So I feel like most of us deal with the thyroid issue if we live long enough. Not everybody, but most women, and more women than men, have thyroid conditions. So we need to figure out, is it coming from the brain or is it coming from the thyroid itself? So usually primary gland failure is the usual cause. So primary gland failure would be the thyroid that sits here. This is the primary cause of hypothyroidism or low thyroid. In some cases, insufficient thyroid gland stimulation, because the brain has to tell your thyroid what to do, so it releases its thyroid hormone. So in some cases, the problem is back in the pituitary gland or the hypothalamus. So simple blood tests can tell us where the problem's coming from. So for example, a TSH, which you're probably familiar with if you have a thyroid condition, is ordered by your primary care doctor. That stands for thyroid stimulating hormone. So that is the message that comes from the brain to stimulate the thyroid to tell it to release thyroid. Now a T4 level and a T3 level, that's telling us how well the thyroid is functioning itself. So it puts out the thyroid hormone T4, and then that has to convert in the cell to T3 by taking an iodine off. And 20% of that conversion does occur in the liver. We'll get more into conversion problems in a moment, but first, let's get back to TSH. So most doctors today, if they're in just regular primary care medicine, order a TSH with a reflex to T4, and that's it, and they stop there. And if the TSH comes back normal, they're like, yeah, you're fine. But that's when I remember at the endocrinology office and in my practice too, that you can have a normal TSH, but if they don't check your antibodies or your T3 and T4, they won't catch all the thyroid problems. And so you need to be aware to ask your doctor if you really truly believe something is going on. I'm using my little putty paste now on my hair. If you think something is going on, you can always ask for a referral to an endocrinologist or ask for the following lab tests: a TSH, T4, T3, microsomal TPO antibody, and a thyroglobulin antibody. So we call that, the microsomal TPO one is the TPO antibody, the thyroglobulin is the TG antibody. That's a better thyroid panel, and that will reveal other conditions, such as an autoimmune thyroid disease. So microsomal TPO antibodies and TG antibodies will pick up an autoimmune disease. Now, it could be Hashimoto's, where you'll have initially, you could have hyperthyroid symptoms, and then it'll eventually fall to hypo or low thyroid symptoms. Or it could be Graves', where it's hyperthyroid. Like you'll see people that have, their eyes are protruding. And if you've ever watched Wendy Williams, that talk show, like hello, or whatever her thing was, hello, okay. She has Graves' disease. And remember when I said it can cause brain dysfunction, if that is not treated well, that can cause other problems. And I wonder if her Graves' disease is part of why she has lost her talk show. So, autoimmune thyroid disease is the most common type of hypothyroidism in the United States. So most of the women that I screen with low thyroid, it does turn out to be Hashimoto's, which is the autoimmune type. Now, we talked about labs, the TSH. So this is interesting because according to American Academy of Family Practice Physicians, the latest updates they had on treating and ruling out conditions came out in 2012. And they still say the best lab assessment for thyroid function is the TSH test. Well, I worked in an endocrinology practice. That did not give us enough information. I get it. It's very important and that should be ordered, but you just can't stop there. You're going to miss so many conditions. So I get it. It's the best test, but you just can't stop there. And I wonder if doctors are reading that and thinking, oh, well, I did that test. It's fine. No, there's more you can do. And so here it talks about there's no evidence that screening asymptomatic adults improves outcomes. Yeah, okay, but sometimes I'll still run those tests and I find that that's going on and I catch it before it's a complete brush fire because it really gets bad if you wait till the symptoms are at 100%. So, of course, they recommend treating with levothyroxine, which is generic Synthroid, it's T4. And then they say doing a combination of T3, T4 therapy has no advantages over T4 therapy alone. Okay, and then they say, and it's not recommended. Well, I have a bone to pick about that, and I'm going to go over that when I talked about conversion therapy. Okay, so let's talk more about that. Here, hypothyroidism is defined as a failure of the thyroid gland to produce sufficient thyroid hormone to meet the metabolic demands of the body. Untreated hypothyroidism can contribute to hypertension, dyslipidemia, infertility, cognitive impairment, and neuromuscular dysfunction. We talked about that. Data derived from the National Health and Nutrition Examination Survey suggests that about 1 in 300 people in the United States has hypothyroidism or low thyroid. So 1 in 300. The prevalence increases with age, higher in females. And 13 million Americans are walking around out there with undiagnosed low thyroid. Do you know that that is a major cause of depression as well? So when I have a patient that comes in with depression and anxiety, one of the lab tests I'm doing is a thyroid test because it just could be their thyroid. Okay, so moving on, let's just talk a little bit about other symptoms. So I'll have patients come in complaining about weight gain, fatigue, poor concentration, brain fog. We talked about depression, just all over muscle aches and pains, and then an irregular period. Now remember, a lot of these symptoms can occur with menopause. So I will look at an estradiol, a progesterone, a DHEA, a testosterone, just to see, what's going on hormonally there. And it also is more advantageous if those labs are checked on day 21 of a cycle, if your patient is still having a menses cycle. Or you can tell your doctor, doesn't it matter what day of the month I get my labs drawn? Yes, it does matter. So also people with low thyroid complain about cold hands, constipation. You hold their hands, it's very, very cold, dry skin. We talked about that. Their muscles get weak also, and they start noticing hair loss. Now, again, that can happen with other thyroid, other hormonal conditions, and also adrenal conditions. So, sometimes I'll order an ACTH, a CAH, a cortisol, a DHEA if I do suspect there may be adrenal component in there as well. Okay, so what we do on physical exam is you'll look at the neck, because right now the neck should be nice and smooth, but if there's an enlargement in this area, it is called a goiter. I finished my hair here. Hold on. And if you Google the term goiter, Google images on goiter, you don't usually see large goiters in this part of the world. Usually we see those in other countries that don't get enough iodine. So when you want to get to the root cause of what is causing thyroid dysfunction, it may simply be low iodine. Why? Well, thyroid hormone needs iodine. That is what makes up iodine, T4. It's a molecule of tyrosine with 4 iodines surrounding it. So a simple things I'll ask my patient is, especially if they're vegetarian, where are you getting your iodine? Oh, they're eating kelp. Okay. Sea vegetables. Okay. Or they're not vegetarian. Maybe they're getting a lot of shellfish and seafood. And how do I want to do my bangs today? Do I want to do it down? No, I'm going to kind of scoot it off to the side. Anyway, another simple thing that I'll ask them is, are you using iodized salt? Because you have to look at the salt you're buying in the store. Salt gets such a bad rap because for years we were told, oh, it raises blood pressure and, you can't lose weight and all this stuff. It's like, yeah, we need salt to live. So I'm not saying over salt and salt everything, but if you're eating a particular diet where you're getting no salt, no iodine, it's not the worst idea in the world to get some iodized salt, and maybe you're putting a little bit every day on your eggs. And that way I know you're getting iodized salt because you need that to make thyroid hormone. Now, there are parts of the world that do not live near the coastlines and they don't have a store nearby that has iodized salt available, and they can end up with a goiter. So you get this big enlargement right here. In our country, when I've seen a goiter, there's a little slight, let me put this down, right here in this area. And I'll kind of feel it like this. The isthmus would be here, and then both lobes of the thyroid go right here. And I'll feel around in there. Does it feel kind of spongy and bouncy? And it just doesn't feel like the rest of the neck. And that's it. Or do I feel nodules in there? Because you can have a nodule in there that's throwing off thyroid hormone levels. It may be producing too much thyroid hormone. Okay, let's add a little shine spray here, and then we'll talk about the problem of converting thyroid. Okay, easy hairdo. That part's done. Then we're going to do some winged eyeliner. Or maybe I'll do something else first. Okay, so then what also we can see on lab work with low thyroid, I might see low sodium levels, right? I just talked about that. I might see low oxygen levels, like poor circulation. I might see a type of an anemia. I might see an elevated creatinine kinase. I might see elevated prolactin levels. And normally when I'm looking into hormones I see mostly women, every now I see men, I will do a prolactin level because every now and then I can catch something going on in the brain with that. And then of course, if I see elevated cholesterol, especially when it's mixed with they're puffy, their cholesterol is elevated, they're getting onset of new depression, definitely want to rule out thyroid. We can also on physical exam, not only just seeing the goiter, but we might see a low heart rate. And again, I look at the lids. Are they kind of puffy and dragged down? Are they, I look at their lower leg and I'll press my thumb in it. Are they retaining fluid or water down there? We'll look at the outer lateral parts of the eyebrows. Are the eyebrows getting thin, or they're losing hair at their outer eyebrows, besides losing hair on the top of the head? I might also have them take their body temperature. So they go home and I'll say, I want the temperature first thing in the morning, at noon, around 3, and then before you go to bed. And I want to have a log of those temperatures, and then I average them out. If on average it's generally below 97.6, that's just another red flag for me that I need to rule out thyroid conditions on lab work. They may also have a little bit of an enlarged tongue, but I do see that in other conditions, so it doesn't always just mean thyroid. And then besides elevated cholesterol, I might see elevated triglycerides on their cholesterol panel as well. Okay, so remember when I said the American Academy of Family Practitioners or physicians say, they only recommend giving T4, they don't see the advantages of giving T4 and T3. Well, it just so happens that not everyone can convert T4, remember that's the initial hormone that comes out of the thyroid to your blood. Not everybody can convert that well. So what does that mean? Well, there is, we talked about low body temperature. There is a condition called Wilson's temperature syndrome. And so listen to this. According to Wilson's temperature syndrome, impaired T4 to T3 conversion can be made worse with T4 therapy. So what's T4 therapy? That's your Synthroid, your levothyroxine, and if a patient cannot convert the T4 by their body very well, then it's likely they will not be able to convert T4 given by mouth. T4 can actually feed the vicious cycle which leads to Wilson's temperature syndrome. If more T4 is given to the body and that T4 cannot convert to T3, T4 will be shunted towards something called reverse T3. And our T3 can be checked on lab work. And a lot of times I'll see that happening when the patient is very ill. So if they've had a long time illness, they're not converting T4 to T3 well, and it's getting shunted over to RT3. And what I believe is happening is when you're ill, your body's metabolism needs to slow down. And I think it naturally has a mechanism where it's not going to convert T4 to T3 and give you energy and keep your metabolism clocking. You need to rest, your body needs to slow down so it can get better. So we see higher RT3 levels. And let's see. That is, if more T4 is given to the body and cannot be converted to T3, and it shunts toward RT3, this may result in further inhibition of the enzyme 5-deiodinase. That's the enzyme that cleaves the iodine off the T4. Then again, it will lead to further conversion impairment. In fact, some of the most severe derangements of the thyroid system are patients who seem to have been pushed too far in the wrong direction. Like they just keep upping the T4 because they just can't get the patient to feeling better. And so they just up the Synthroid when it's like, no, you got to get down to what's wrong underneath. And I'll get that to a second. I'll get to that in a second. So in this article I'm reading here from Wilson's temperature syndrome, it says T4 medication is not always a preferable and excellent method of treatment. It's just that it's not always the recommended treatment of choice to just keep giving T4 and upping T4. In every case, the choice of thyroid hormone medication and is adjusted and is monitored depends on the other underlying cause of the hypothyroidism, because not everyone with low thyroid has the same cause, okay? Okay, so now let's talk about, let me go here, okay, and then we're gonna go here. Okay, so now before we start talking about underlying causes of low thyroid, I have got to get some eyeliner on, okay? So I'm gonna use my thin brush here, and I'm going to use this little pot today. This is, who is this by? L'Oreal. This is the L'Oreal 24-hour liner. I do like this stuff because, oh my gosh, does it last. I know in a lot of videos I show myself using powder liner, but this, this will last all day. And I have a lot of errands to run today. I am going to go buy the Ninja Creamy, because you can make ice cream and sorbet with that with all good ingredients. So you can throw fruit and water, like if I want banana ice cream, I can throw some bananas in there, maybe some natural vanilla flavoring and some water, throw it together and you can make banana ice cream. I'm so excited because that is my weakness, is ice cream and frozen yogurt. But I'm gonna have another video come out this weekend because I'm starting a whole new health overhaul. And if you guys want to join the journey of the health overhaul, I'll have that video coming out later today. And part of that for me, I'm making a mess. Part of that for me is getting that Ninja Creamy. Oh, this side's better. It's because I'm talking while I'm trying to do this. So this is like a gel formula, and besides getting it down there, I do like to get this one on my waterline. Again, it is gonna last all day. Even if my eyes start to water, where my eyes water a lot, and again, it's not from wearing eye makeup. If I don't wear eye makeup, my eyes water, it doesn't matter. And part of that is when we become menopausal, our eyes do dry out, and there is therapy with progesterone. There's compounded eye drops you can do. So if you correct some of the hormone issues, your eyes will stay in better health. But you know, there's other autoimmune conditions like Sjogren's that can cause dry eye. I do not have Sjogren's. When you have Sjogren's, you usually have dry eye, and you probably have dry mouth too. And autoimmune conditions like Hashimoto's that we just talked about tend to run in clusters. So like if you're diagnosed with an autoimmune thyroid issue, again, you had that microsomal TPO test done and it's positive, you have to really watch your blood sugar. You have to watch your intake of gluten. And actually with any thyroid patient I say, you know, you better pump the brakes on the gluten, because today's wheat products, rye, barley, hops, other grains, they may have pesticides on them, glyphosates on them, or they may be genetically modified. It is not the same ancient wheat that we were used to. And I think we're seeing autoimmune thyroid conditions and other autoimmune conditions off the charts now. And I wonder if it is what we're putting in our foods. Okay, so we're going to take this new eyeliner I got yesterday, and we're going to really wing it out today since I'm just doing some shopping things. And I can look a little bit more winged out right now. So let's really kind of, again, I'm going to angle it up because I have loose eyelids. So we're going to really angle this thing up this time. Let's just go for it. Oh, that's going to go way up there. Hello. Ooh, but I kind of like it. And obviously the higher I put the stencil, the bigger the wing. But I would not have been able to do that freehand. Okay, but I'm going to have to fill that in. So let's do that now. Let's fill it in. So I got to go across here a little bit. And I'm hoping this liquid eyeliner doesn't travel upwards into my wrinkles. But if it does, I'm going to use this gel eyeliner and take care of it. Okay, I think I need to fill that in more, right? Probably. Let's fill it in a little bit more. And then what I mean is, this triangle action. How about that? I would not do this every day. It's just kind of fun for right now, because wait till you see what I'm going to do next on my face right here. Okay, let's put this up really high here. Let's see if we can make it somewhat even. I don't know what's going to happen. I don't think that's as high. I can already tell it's not going to be. Is it? It's not totally even, but good enough. Good enough for going to the store and picking up the Ninja Creamy. I'm so excited because I swear every night my husband and I are like, should we go get ice cream? You know, we shouldn't have it. Like, we shouldn't be eating ice cream. It's really bad. But then sometimes your cravings get the best of you. I know, I'm human too. I don't always eat perfect, but again, getting this Ninja Creamy, I'm going to start my new little health overhaul because my pain is through the roof right now. Okay. Well, you know, really, it's just to show you the stencil. I'm no expert at this, but I'll keep practicing. I think it'll be kind of fun for Halloween. Oh gosh, did I ruin that? Yeah, probably. Okay. Well, here, I can get rid of that in a second. I'm gonna use our little coconut oil, get rid of that. And then I'm gonna use an eyeshadow and just kind of correct the not so even look of that. Get a little tissue. Okay. There we go. So, okay, back to thyroid. Okay, so let's talk about underlying conditions. Why do you have low thyroid? Or your mom, or your sister, or your girlfriend, or your best friend? Why do you have low thyroid? Well, everyone has a different reason. So let's start from the beginning. So one reason, like I talked about, was being sick or ill or a chronic disease can cause problems converting T4 to T3. Remember, the body has to have it in the T3 form to work in the cell, to get our metabolism up, to get our body temperature up, to give us energy so we feel good and we can maintain our body weight. And, you know, there's so much that thyroid regulates. It really is the master of the metabolism and the body temperature. And it does influence how we burn fat, keeping our cholesterol at a normal level. So, okay, another reason is mineral deficiencies. So there are certain minerals, for example, selenium. Selenium is a crucial mineral. If you're not getting selenium in your diet through, for example, Brazil nuts. Brazil nuts are very high in selenium. Sometimes that's all the patient needs to take a day is a couple Brazil nuts to get enough selenium. Zinc. Zinc is another mineral which helps support correct thyroid conversion. And by the way, zinc is so great with immune support as well. Other problems could be gastrointestinal problems. So for example, if you have an inflamed gut, if you have celiacs, if you have gluten intolerance, if you have SIBO, if you have leaky gut, you're not going to absorb nutrients and you may not get those crucial minerals to help support thyroid function. Even if you're not deficient in selenium or zinc, you can have problems with digestion that can affect the conversion of T4 to T3. So now T3, we talked about that. Do you know it doesn't become active until it's activated by an enzyme called intestinal sulfatase? So to have that working, you have to have a healthy GI tract. Now, in one of my videos, I do talk about SIBO, and then there's one I talk about SIBO for doctors, and it really does a deep dive into treating SIBO and achieving a healthy gut. But there's a lot of tests your doctor can do. But if I have someone that has either chronic constipation or diarrhea or gut pain or symptoms of diverticulitis or irritable bowel disease, Crohn's disease, a history of colon cancer. Like there's so many diseases of the gut, H. pylori, ulcers, there's the eosinophilic esophagitis, which is a deep inflammation of the esophagus, and then you're not eating well. I mean, there's just so many things. So other than that, so we've talked about mineral deficiencies, gastrointestinal problems being underlying causes of thyroid problems, liver issues. So 20% of the conversion of T4 to T3 takes place in the liver. So if you don't have a healthy liver or a properly functioning liver, you may be one of those that are not converting T4 to T3 well. And if you're just on Synthroid and it's still not working, is your liver healthy? So what causes an unhealthy liver? Well, some people are walking around with, there's two types. There's alcoholic fatty livers or non-alcoholic fatty liver disease. I see more of the NAFLD. That's the non-alcoholic fatty liver. So if my patient's overweight, they're eating a lot of sugar, they're eating a lot of carbs, they're gaining weight around the middle, or they're menopausal and now they haven't changed their diet, their lifestyle, or anything, they start getting weight around the middle that leads to insulin resistance, they could end up with a fatty liver. How we monitor that? Simple lab tests on a metabolic panel. It's the ALT and the AST. These are liver enzymes. Once they elevate above the normal range, then we may be dealing with fatty liver disease. So now there are things you can do, increasing fiber, walking every day. I love milk thistle, but now milk thistle can help support liver function, but I do advise my patients if they're on certain medications, they cannot take milk thistle. So this is something you always want to talk about with your doctor. Now, if your doctor's not familiar with natural therapy, you can find a naturopathic doctor in your area. These are doctors that understand herbs and contraindications with medications. So whatever your opinion is about naturopathic doctors, my advice is to find one that is licensed, because depending on what state you live in, anyone can call themselves a naturopath. Now in Arizona, you can't. You have to have gone to medical school and have passed your board exams, and now you have a license in naturopathic medicine. In an unlicensed state, if someone wants to call themselves a naturopathic doctor or an ND, they can. So, I don't know, I should do a separate video about being a naturopathic doctor. I'm a naturopathic medical doctor. Okay. Other problems are, remember I talked about adrenal problems. That's another underlying condition. So someone could have altered cortisol levels, whether they're high or low, but high cortisol levels, usually when someone is under undue stress, that can inhibit conversion of T4 to T3. And so then I'll have to sit down and talk with the patient about their stress levels and their diet and their health and their activity and their job and, really get them on a path to wellness. There's some herbs that I do recommend my patients for adrenal problems. I love ashwagandha. I've talked about that in prior videos. That's a good one. Rhodiola. I like passion flower or passiflora. Rehmannia. That's a good one. But again, don't just willy-nilly hop on an herb. Maybe try to talk to an expert first. Now, patients could be on medications affecting their thyroid. So, for example, a lot of doctors treat thyroid patients because they get a racing heart rate with a beta blocker called propranolol. Do you know that medication can inhibit the conversion of T4 to T3? So also, other types of beta blockers, metoprolol, propranolol, atenolol, these are all beta blockers. And again, that has to do with, we call it beta blockers because it does affect there's an alpha receptor and a beta receptor, and it's a long story, but so it's a class of drugs. Patients with Graves' disease, which is hyperthyroidism, may be put on these beta blockers to manage cardiac symptoms, and again, that can affect thyroid hormone. Corticosteroids like prednisone, or some people get injections of cortisol for back pain, shoulder pain. That can affect how you convert your T4 to T3 thyroid hormone. And as a reminder, T4 is like a Synthroid or a levothyroxine. You take that medicine and we rely on the body to convert that to the active form T3. And I'm going over what can inhibit that. So how do we correct that? So some doctors, some traditional doctors and endocrinologists will put their patients on T3, which is called Cytomel. So we have Synthroid, which is T4, Cytomel is T3. We have to be careful with Cytomel because if I have a patient over the age of 55, we do worry about Cytomel can increase heart rate, and it can put us more at risk for osteoporosis. So we have to be very careful with that. So I am not fast and loose with prescribing Cytomel. The same is a risk with Armour Thyroid, Nature Thyroid. These are combinations of T4, T3. Now, we used to be able to prescribe a compounded T4, T3 and tailor it just for the patient. But unfortunately, there's legislation, and I believe the FDA is involved with that, where they're going to make it no longer an allowed thing to prescribe compounded T4 and T3. So yet they've made that. And that's all I'm going to say about that for now, so I don't get canceled. So, you could work with your natural doctor, your functional medicine doctor, your naturopath on, hey, can I take ashwagandha? Can I take coleus? What else can I do in my life to make my conversion better? All right, so I think we went over that. So we went over chronic illness, nutrition, leaky gut, mineral deficiencies, liver problems. See, all these things can be underlying factors. Now, what's interesting with low thyroid that we didn't go over? I have had some thyroid patients that maybe they lived in a part, because, I'm in Arizona, they might have lived in a part of Arizona where they were downwind from the nuclear testing sites in Nevada. So I guess back in the 50s, they were testing atomic weapons. And the way the wind blows, it was blowing down towards parts of Arizona. And I want to say it was more in I can't remember if it was in the Prescott or Payson Valley. And a lot of those patients ended up with thyroid issues and a big incidence of thyroid cancers. And so, I talk sometimes about Lugol's iodine. So what is this? Lugol's iodine is potassium iodide. This one is a 4% potassium iodide. It has 2% iodine, and the rest is water. Now, it's safe for me to recommend this for patients. They couldn't put it topically on a little sore or an abscess because it's a great disinfectant. However, if I am going to recommend it internally for thyroid problems or other types of infections, and I'm not going to tell you the dosages here. In fact, I'm going to tell you, please don't take this internally because you can shut your thyroid down and you can end up with some big problems. So you do have to work with an endocrinologist that understands how to give thyroid, or a naturopathic doctor that understands how to do this. There are companies that actually make iodine in a supplement. Again, I think the safest way of getting your iodine is through iodized salt or sea vegetables, kelp, etc. But if doctors understand how to treat thyroid with iodine, there is a product called Thyroid. So this one happens to be 6.25 milligrams of iodine, and the capsule, is this one open? No, this one's sealed. I can't open it. But it's like a black capsule because, iodine's really, really dark. But with the Lugols, we do have a nuclear power plant, and if that thing ever goes down, myself and my patients have this in their house, and they'll instruct them on how many dropperfuls to take to protect their thyroid from getting exposure from all that radioactive iodide that's going to be released into the atmosphere, because the thyroid has an affinity for iodine, right? So it's just going to suck up all that radiation. And that's why we recommend in a emergency first aid kit, especially if you live near a nuclear power plant, you really should have some potassium iodide in your emergency first aid kit. The nice thing about this, there really is no expiration date on this, if I'm not mistaken, because again, not much can survive in this. There's no bacteria or virus that's going to survive in this bottle. So, but every now and then the dropper goes bad, like you can't squeeze, like this one's nice and squishy, you can squeeze the dropper. If the dropper gets really, really hard, then I go ahead and replace it and I get a new bottle. So that one is the brand J. Crow's Lugol's iodine solution. It's a 2%. I don't think they even sell the 4% anymore. But there's that. Okay, Now there's also a company, this is Priority One, and they make something called Thyroid Support. Now let's look at the ingredients of this. So we have B vitamins like thiamine, which is vitamin B1, riboflavin, which is B2, niacin, which is B3, iodine at 450 micrograms, magnesium, zinc, manganese, potassium. It's got myrrh. I talk a lot about myrrh. It's got myrrh here. It's Commiphora mocal, tyrosine, and aspartic acid. Now that's interesting because there's no selenium in this one. There is zinc though, so I would say the only thing this is missing is selenium. But again, you could pick up some Brazil nuts. Again, talk to your practitioner first. Don't just start taking all these things. Again, I'm a physician. I talk to my patients about this, but for me, I'm going to refer them to this video because that's going to save me an hour of talking to them about educating them on thyroid, plus they're going to learn about winged eyeliner, how not to do it. Now, there's other companies that make thyroid support. So if I have someone that's maybe borderline hypothyroid, I may put them on this to delay needing medication. Sometimes the other thing that I do is an ultrasound of their thyroid if I do detect a goiter, because I'm looking for thyroid nodules. You always want to make sure, if you're a practitioner watching this, that you want to rule out thyroid cancer. And that's why the TG lab is very important. That will be elevated when you have, that's thyroid globulin. That will be elevated. And there's TSI. I mean, there's some other specialty thyroid labs you should be doing if you're ruling out thyroid cancer. But anytime you have a patient with an enlarged thyroid, please rule out thyroid cancer. So I will send my patients with goiter to have an ultrasound, a thyroid ultrasound. And if I'm managing a thyroid nodule, which usually I'm on a team, I always refer to an endocrinologist. Myself being a naturopathic doctor, I just want to be part of the team. But I always do recommend my patients to see an endocrinologist. Not all of them will go, but I do recommend it. All endocrinologists are different. So if you're not happy with your endocrinologist, see another one. They're different. So don't give up if you're not having results with the first one you try. There's some great endocrinologists out there. Okay, this video has gone on 41 minutes. Do I have anything else to add to thyroid? Well, I guess I'll say a story. I did have a patient referred to me by another doctor for a thyroid condition. And when this patient walked in, not only did she have a very enlarged goiter, it was black, necrotic, it had sores on it. And that was probably the worst case of untreated thyroid cancer I have ever seen. And I honestly don't know why a doctor referred that to me as a naturopathic doctor. I mean, I don't prescribe chemotherapy. I don't do surgery on thyroid. And unfortunately, I had to have a long discussion with the patient because I think part of it was she was in denial and thought there was still a natural treatment available for this. And I had a long talk with her that involved hospice, and she had her spouse with her because that's where we were at, was hospice. So anyway, so I hope this video was helpful. Please, if you have any questions to add or comments, please leave the comments below. I would love to hear your story, or you know, if I forgot to go over a piece, because I probably did. I forgot to go over something. I'm not perfect. Let me know in the comments and I'll do a part 2 on thyroid and I'll answer your questions. So that would be great. Thanks for watching. Subscribe and like if you haven't yet, and I will see you on the next one.